Dr. Lalit Kumar sir, please start the program. Dr. Lalit Kumar.
Murli Krishna. Murli Krishna. Murli Krishna. May remember Harsha Murli.
Yes, you are here. Fine.
Shall I begin, sir?
Yes, sir, please do.
Only two audience are there. Okay. Now the Felicitation program begins. Good evening, sir, and a happy Doctor's Day to everyone. Honorable President, respected Secretary, our most valued Chief Guest, Dr. M.C. Gupta, ladies and all gentlemen. Am I audible to all of you?
Yes, sir.
It is an honor and privilege for me to be here today, to have been asked to greet all of you on this occasion. I, on behalf of Medicolegal Society of India and the entire, let me call it fraternity of doctors here together, and on my own behalf, extend very hearty congratulations to all of you to be here to grace the occasion. Well, Mr. President, ladies and gentlemen, an event like this cannot happen overnight. The wheels start rolling weeks ago. It requires planning and a bird's eye for every detail. We have been fortunate enough to be backed by a team of very motivated Mr. President and ladies and gentlemen, dedicated colleagues of Medico-Legal Society of India, which includes our omnipotent Dr. Rajiv sir, who know their job and are result-oriented. I can't congratulate everyone enough for their involvement and their willingness to take on the completion of the job beyond their comfort zones. Mr. President, ladies and gentlemen, once again I wish to state that we feel most grateful to Honorable Dr. M.C. Gupta, sir, who accepted our request with all grace to be here to honor our sentiments. I would like to quote a lovely couplet from his ghazal, who makes us crazy by design. दीवाना खलिश हमको दुनिया ये समझती है, दीवाना खलिश हमको दुनिया ये समझती है, हम हैं कि जवाने को दीवाना बताते हैं. By felicitating Dr. Gupta, we are respecting our culture, roots and traditions. We have been taught that all the seniors are our gurus, and feeling you as a guru, I fondly greet you. Sir, you are helpful to us for legal issues wherever and whenever needed. We feel honored to be with you today. Hope you will enjoy the roots and traditions. Celebration now begins with lighting the lamp, not physically, but well inside our hearts, which leads us from darkness to light. I would like to invite a person who is really admirable to all of us, who supports others' welfare and upholds strong moral standards. You strive, sir, to achieve these goals in your professional or personal life. He is our treasurer, He, he will now introduce the chief guest. Over to Naurange sir, Dr. Jayant Naurange. He will introduce Dr. M.C. Gupta now.
Thank you, Dr.
Dr.
Lalit.
Naurange, sir.
I hope I'm audible. Respected Dr. M.C. Gupta, sir, good afternoon.
Afternoon, Dr. Narangi. How are you?
Yeah, it's indeed a pleasure on my part to take part in the inaugural session of, inaugural opening remarks of your felicitation. Here we are not only celebrating 1st of July as a Doctor's Day, and we are felicitating a senior doyen like you in the field of medical legal issues, but we also celebrate simultaneously, which is just 48 hours down the line, as what Dr. Lalit said, we are felicitating our Guru. It's a Guru Purnima on 3rd of July, that is the full moon day of Ashad, and it's celebrated to pay our respect and homage to the senior most and very, very philosophical, very simple, humble, straightforward person like you. I had an occasion to meet you twice, sir, once at Dinanath Hospital and sometime later in Pune.
Yeah.
And I was really, indeed, it was my pleasure to learn so many things from you. And here I would say for whole of India, we are very proud of you. And the specialty which I would say you are actually in fact set in, that is a clinical side of medical legal issues. I think no one has taught us in this particular fashion. Whatever we have been taught in forensic medicine is quite different from what is required in practice, and especially after the medical legal issues and flooding of cases seen after the Consumer Act. And your views explaining the real thing, real side of the laws, rules made thereunder, the real meaning in absolutely selfless way has gone a long way to inspire us. And what similar as what Dr. Lalit said, that you have given us the light which is showing in our hearts and mind. And this is an occasion to reciprocate small token to what MLSI, that is Medicolegal Society of India, feels. And it was the initial idea of Dr. Lalit, Dr. Raju, and all those who are active participants in the MLSI. And it is coming true on an auspicious day, Doctor's Day, as well as Guru Purnima. With this, I conclude my opening remarks and hand over mic to Dr. Lalit and Dr. Raju.
Quick. Well, sir. Thank you for your appreciation to Dr. M.C. Gupta. Here you will find now a personality who is full of humility. He allows people to understand his strengths and weaknesses through a lens of acceptance. He is a very noble man who has various fundamental qualities that enable him to act authentically, exceed traditional standards and work in alignment with their core values on a consistent basis. He possesses strong morals, is ethically minded, and interact with others virtuously using these tenets. You are correct in your guessing, and he is our respected Dr. Narasimha Rao, coming to enlighten you with the CV of our chief guest. Over to Dr. Narasimha Rao.
Hello. Am I audible?
Yes, sir. Please go ahead.
Yes, sir.
Yeah. So thank you very much for those kind words, sir. We're honored to read out the distinguished biodata of Professor M.C. Gupta, sir. So, sir has passed his M.B.B.S. and M.D. from our country's premier institute, which is AIMS, and has been there a faculty for about 18 years. Thereafter, he has been a professor at the National Institute of Health, where he was also the dean. Thereafter, he has an M.P.H. degree from University of San Carlos, America, and also a fellow of the United Nations University. He has been recipient of the National Citizen Award in 1992. He was a fellow of the National Foundation of Clinical Forensic Medicine. He's completed his LL.B. from Delhi University and LL.M. from Kurukshetra University. He joined the bar in 2001, which makes him probably a longer serving advocate than a longer serving physician. So he's practicing advocate in health and medical law as area of special interest. He's a member of the Supreme Court Bar Association and the Indian Law Institute. He takes up cases for both patients and doctors and has been engaged for his legal expertise in several IMAs and other associations of doctors. He is a frequent, he argues frequently in the National Commission. He is also filed and argued writ petitions and appeared before the MCI and various state medical council and also before the PNDT authorities. He is dealt with criminal cases pertaining to complaints under Section 304A. He's been a member of the ethics committee of various hospitals and institutions, and he answers medical legal queries, which in the Google group, Medicolegal group, in which I'm a part too. And I really admire his methodical approach to any question. He breaks up the question just like a typical well-read physician would do. Break up a problem into many parts and then address each part and make it look very simple. My prof in college used to say, a true genius is a person who makes a complicated matter look very simple. And I think, I believe Professor M.C. Gupta is a proponent of such distinguished achievements. So thank you very much for the opportunity, sir.
Thank you, sir.
Yeah, may I hand over back to Lalit, sir, please?
Yes, thank you, sir. Here now comes a very, very confident in the face of flaws and possesses a level of self-aware. He is our Dr. Shiv Kumar Kumbar, who crafted the beautiful citation. Over to Shiv Kumar Kumbar. Please take on, sir.
Yeah. Thank you, sir. Am I audible, sir?
Yes, yes. Audible.
Yeah. Good evening, everyone. Respected Dr. Raju Joshi, the founder, Dr. Sanjay Gupta, the president, Dr. Jayant Naurange, very close friend of mine, treasurer, Dr. Lalit Kumar, convener, and Dr. Raju Joshi on the other day said me to write a citation. I was a bit hesitant because looking at his biodata, his involvement in medical social activities all over India. Yes, I said, yes, definitely I will do something. I will write a citation. Yeah. The citation to Dr. M.C. Gupta. We, the members of the Medicolegal Society of India, are amazed at the contribution of Professor Dr. M.C. Gupta to the medical legal fraternity and filled with admiration to felicitate this renowned medical legal expert of India on Doctors' Day, the 1st July 2023, on the eve of Doctors' Day. There are no words to express our gratitude to the most knowledgeable person, none other than Dr. M.C. Gupta. He is the guiding force for all the doctors in India to say that ignorance of law is not permitted. Ignorance is the bliss for those who are lucky. Unlucky people know the cost of the ignorance. Ignorance breeds anxiety, tension, and a host of negative feelings. Dr. M.C. Gupta's strength of character and uncommonly perceptive mind made him widely recognized and highly regarded medical legal professional in India. His quiet and astutely comprehensive approach to the pursuit of clinical excellence and interpretation of the medicine and law has made beacon for the medical professionals. We wish to communicate our utmost regard, respect, and admiration, as well as gratitude to Dr. M.C. Gupta for his unparalleled accomplishments. It is a person like Dr. M.C. Gupta who can restore our faith in humanity. Sir, we respectfully say that we will never forget your mentorship, your wisdom and dedication. You have been a solid rock in our medical legal issues. We will be forever grateful for your inspiring motivation, your shared insights, and your gentle guidance. May God continue to richly bless and watch over you and your family. May God grant you peace now and always. Our best wishes are always with you. From Medical Legal Society of India, Dr. Sanjay Gupta, the president, Dr. Jayant Naurange, the treasurer, Dr. Lalit Kumar, convener. Thank you, one and all, sir.
Thank you, sir. I shall invite now the most respected, our acting president of MLSI, Dr. Mukesh Yadav, who will be giving some details of the activities of the society before you. Over to Dr. Mukesh Yadav, sir. Dr. Mukesh Yadav, sir.
Good evening, sir. Thank you for giving me a opportunity to introduce about Medico-Legal Society of India, which is a brainchild of Dr. Rajiv Joshi, sir. And we have very short history of establishment, but very big achievements. We as a society intervene in many cases pending before the Supreme Court to fight for the rights of the medical fraternity. We also intervened recently in Kerala High Court, where violence against doctor is a very important pertinent issue to fight for. Dr. Rajiv Joshi already have filed PIL in Maharashtra in Bombay High Court. So within a short time, we have achieved many milestones, which is a great proud for all members of the Medico-Legal Society of India. My request to all members and participants, because we are having today felicitation of Dr. M.C. Gupta, who is connected with me since a long time, but due to physical distance, we are not able to connect. And he helped in many cases by giving advice, proper advice at right time. And since the time is to listen Dr. M.C. Gupta, I conclude my remarks regarding Medico-Legal Society of India and invite all those who are the audience to please join Medico-Legal Society of India as a member for greater cause to improve the medico-legal system and protect the medical fraternity whenever a legal cause arises. Thank you very much to all of you. Over to Lalit.
Thank you, sir. Thank you, sir. Now, the most important job is going to be accomplished by Advocate Chapalgaonkar, sir, who is loyal to his values, ethics, and the people who he cares about. He possesses a faithfulness that guides his actions and allows him to defy or to uphold the promises he makes. He'll be doing the most important job today to offer Saul, Srifal, and the certificate to Dr. M.C. Gupta, sir. Please go ahead, sir, if you are on the screen.
Thank you.
Advocate Chapalgaonkar, sir. Not visible in the...
Dr. Joshi, you can stop sharing the screen for a moment.
Okay, just a minute. I'll stop sharing. Yes, so now we can see. So I'll try to make that slide bigger. Just a minute. I'll try to make only one slide. Yeah, now how do I make only this slide bigger?
Siddharth, you can speak something so that you are on the screen.
Siddharth, you can speak something?
Yeah, now we can see.
Okay. Clapping.
This is the citation.
Everybody else, please don't say anything. Let Siddharth do the honors.
Thank you, sir. Thank you, sir, accepting
This is the citation.
the sawal and everything.
Thank you.
We are really thankful to you, sir.
This is the certificate of appreciation. Oh,
Beautiful.
Thank you. Congratulations.
करके दिखाओ सर्टिफिकेट सामने देखा देते
Yeah, now we can continue with the proceeding.
Okay, should I start now?
Thank you, sir.
Sir, bear with me for a minute. I will project your slides.
I shall now be inviting Dr. Pratibha ma'am, who has accepted to avail the power of Lakshmi today.
Sir, little later, sir, after sir's lecture. Dr. Pratibha will come after sir's lecture.
She is not here.
No, after sir's lecture, sir. Now we are going to start sir's lecture.
Pratibha ma'am is not there.
No, sir. Her event will be after lecture.
Okay.
So I will share slides and
Sir, I'm
show.
here.
Ma'am, after the lecture.
Okay, ma'am.
Yes.
Ma'am, after the lecture.
Okay.
I will show sir slides now.
I shall invite the chief guest now. He is the epitome of all the qualities a man can possess. He is a doctor, he is a lawyer, he is an author, he is a poet, and above all, he is a friend indeed. He can be none other than Dr. M.C. Gupta, sir. Over to him for the much awaited talk today. To understand him better, I shall just chant a few lines of his poetry before he begins. है आज नहीं अपना कल का भी भरोसा क्या, माजी ने हमेशा ही पर साथ निभाया है. अशकों में मोहब्बत की लाचार कहानी है, उल्फत में रही मेरी नाकाम जवानी है. यू आर जवान सर. कठपुतली बन जाएंगे, कठपुतली बन नाचेंगे, तो नाचे ही हम जाएंगे. कब तक मन में पीड़ा पाले ऊपर से मुस्काएंगे. Thank you, sir, for listening your own poetry. Over to you. Please begin your talk.
Okay. Should I begin? Dr. Joshi, can I begin now?
Begin. I will try and start the slideshow. In time you can begin, sir.
Okay. First of all, I thank you very much, Dr. Joshi, Dr. Lalit, Dr. Mukesh Yadav, Dr. Navrange, all of whom I have met were such nice friends of mine. It was so nice to listen to them telling some good thing about me, which I deserve or not, I don't know. But it is true that I have tried to trod an almost unbeaten path. When I started my medical legal queries group, senior doctors, my class fellows who are doctors, they advised me not to do so. Because they said, because they told me that something may wrong happen somewhere, somebody may sue me for giving wrong medical advice. So people discouraged me, but fine, I got over all of that. Now, I will start by saying that I was given the choice to choose a topic. I have given talks very often earlier. Topics are not easy to choose and not difficult to choose for me. But this time I chose a topic which was new to myself also. This was doctors as lawyers. And I thought such a talk would encompass my experience over the last 22, 23 years as a practicing lawyer. So now next slide will show what are the various headings under which I will give this talk. And the first of all among them is, who is a lawyer? Now, the word lawyer is rather a loose word, and anyone who has done an LL.B. degree, they think that they have become lawyers. So I thought, for the sake of clarity, I would define who is a lawyer. I don't have to define really. This is the Advocates Act 1961, which says very clearly that a doctor is a person who, the section 2A of the Advocates Act says, advocate means an advocate entered in any role under the provisions of the Act. In simple words, it means under who is registered with any bar council. So it is not that lawyers are some people who are heavenly or from other planets or who are exceptionally bright. It is not so. They are like other professionals. But it is my belief and understanding and experience also that in any subject, whether be it medicine, architecture, engineering, or law, if one has a degree in that, then the fundamentals become more clear. Merely by reading books, though it is very useful, one does not understand the full nuances of that subject. That is why, I can tell you a small, not a secret, but small thing. I have been in touch with MLAG, Dr. Neeraj Nagpal, Dr. Neeraj Nagpal. I have met him several times. He's a good friend of mine. I have suggested to him 2 or 3 times that why doesn't he join a law course, get an LL.B. degree. But anyway, he was not interested. Now, someone mentioned, I think Dr. Mukesh Yadav mentioned, how Medicolegal Society of India has prospered and thrived so well so soon. Apart from the individual characteristics, I think one of the reasons is that Dr. Joshi is a law graduate, and he has been an active law graduate. He may not have enrolled with the bar, but he has been working actively in the field of law, which can come only through practice and with a basic law degree. So that explains why he is so successful. Now, I want to go to second point now. Why should a doctor think of becoming a lawyer? This subheading I have chosen because there have been many people, doctors, who have been telephoning to me in the past, maybe 50 or 60 so far, who say that either that I am an LL.B. and I want to join the bar to practice as a lawyer. What do you think? What is your suggestion? Because we know that you have been doing so you can give us correct advice. Some people say that we are interested in law. Should we go ahead and get a law degree? So there was another person who really spoke to me saying that I am an M.B.B.S, Master of Dental Surgery. My wife is an M.B.B.S. My parents are both M.B.B.S doctors having a very good practice. I have a good dental practice, but I do not have somehow satisfaction. And do you think, and I'm interested in law, do you think I should join law? So I have been encouraging these people, not on theoretical grounds. I have been encouraging them and they have felt encouraged. Many have followed my advice. Because I myself belong to that breed, that I have been a professor of medicine, but last 22 years I have been practicing law. And so I can see both sides of the coin. I can speak from experience. So second thing was that, first thing is there must be innate desire. I had that desire in me As a matter of fact, I joined LL.B in 1984, and I had done half the course, 3 semesters. But I was in AIMS at that time, faculty member. But then I had to go abroad on an assignment. When I came back after 1 year, I could have restarted my LL.B. Because in those days, and maybe now also, we used to get 7 years to complete LL.B. So this could not have been a problem. I could have resumed my studies. But I was so busy, life in AIMS and in any hospital for that matter is very busy. So I enrolled again in LL.B. in 1997, which was 1 year after the death of my Mrs., who was a doctor. And one of the reasons I can tell you, it's a bit amusing, but it is a fact. You see, sometimes as it happens in any family, my wife used to say, "Oh, you argue so much. Why don't you become a lawyer?" So when she was no more, I thought, let me fulfill her this wish. And so I joined the LL.B. again, second time, and became a lawyer. I'm telling this in the context that one must have an innate desire to be successful in any field, medicine, engineering, architecture, whatever it is. Because unless a desire is there, one can work, one can succeed theoretically, one can get a degree, but that desire, if it is not there, then nothing happens. Okay. So second thing is that I'm saying, why should a doctor think of becoming a lawyer in that context? Second thing is that sometimes we see injustice around. Not sometimes, but often. We see injustice around, and that is why we have got social activists and activists of so many types. But I know, and you will know, and you know, and all of us agree that often injustice is practiced against the medical profession, against the lawyers. So I will come again to this topic about injustice. So one thing is that some people may like to become a lawyer because they want to fight injustice against the profession, or they may also like to use law as a means of improving healthcare in the country. Examples are the Common Cause, which has filed, his name is so common you might have heard it. So the Common Cause, which had filed several writ petitions. One of the writ petitions that they filed in the Supreme Court was against the practice of blood given by donors against payment of money. In other words, the rickshaw pullers and drug takers and the...
May I interrupt you, sir? Slightly loud voice, or you may be required to speak in the microphone, sir.
Okay, is my voice low? Okay, I would try to speak louder. Please let me know if it is okay now. So I was saying that these paid donors were rickshaw pullers, or those who unemployed laborers or take drugs, etc. So they were often going to blood banks, giving blood, and the blood was sold by the blood banks. So this petition filed by Common Cause was instrumental in getting direction issued by the Supreme Court that henceforth there will be only voluntary blood donation. The blood donation against accepting money will be stopped, and that ensured that the blood in the blood banks was of a much better quality. So some people may have an attitude towards law so that they can improve the health of the country. Some doctors, I'm saying. Now, other examples of challenging the injustice. Now, again, the medical profession, I'm saying. Delhi Medical Council does not allow the lawyers to defend an accused doctor. In other words, a patient complains to medical council, they issue a notice to the doctor that defend yourself, give your reply of defense, we will hear you. But they do not. The sound is very clear. What can we do? Can you make the sound louder? Okay, I have got a message that sound is slightly low. I will try to set it right. Meantime, I will try to speak even louder. So, I was on the point that Delhi Medical Council does not allow doctors to defend the accused doctors, does not allow lawyers to defend accused doctors. Is the voice better now? My voice quality? Is it louder now?
Slightly better.
Yes, sir.
Okay. I will try to improve on that also. Thank you very much. So, this is injustice against doctors. That we are denied legal defense. It's a fundamental right of anybody for that matter to have legal defense. But in addition to that, the the nation and MCI conduct rules, the ethics rules 2002, I think it's regulation 8.2, they clearly state that when a complaint is filed against a doctor, then he can defend himself in person or through law. So my problem is that doctors, they tend to accept injustice. They don't fight against it. But otherwise they keep on crying that injustice is done against us. So you see, if we are troubled by injustice, we have to fight it. As simple as that. Now, so that was in the context of some people liking to become lawyers, some doctors, to challenge injustice. And I've already told you about medical professional satisfaction, about the dentist couple. Now, finally, I want to make a clear statement which may help some people to make choices. Even as a career prospect, law is a good profession. I know, and you would know, that how difficult it is to get admission to a postgraduate course. We also know that without a postgraduate degree, a practice of medicine is not of that high quality. Why? It is because an M.B.B.S. doctor has to compete against quacks. And to compete against quacks, an M.B.B.S. doctor would very often like to compete with a person who is his peer, not with quacks. So there may be, I know there are doctors who are not able to find jobs and who are not very much enthusiastic about setting their own practice as a doctor, general practice. Now, for such doctors who are not able to have a good career through medicine, practice of law can provide a good career prospect. I am speaking slightly at length on this and emphasizing this because this I can speak with my experience, with many other, and there are not very many people in India at present where doctors like me are there who have been practicing law. So I mentioned only about the doctor having a good practice as a lawyer. But if we go ahead, there are many more avenues for a doctor with a law degree. Because he can get an LL.M, get a PhD, which are not difficult things, and then he can be part of a law faculty in law colleges, and many more things like that. I will not develop on that in detail now. Let me come to the third reason, or third point. Why can't a doctor practice both professions, that is medicine and law, at the same time? What I mean is this. If a person has a medical degree like M.B.B.S. and also has a law degree like LL.B., then why can't he practice both the professions? That is the question. This question was answered way back in 1996 by the Honorable Supreme Court. The citation is Dr. Neeraj versus Bar Council of Maharashtra and Goa. Dr. Cholani is a gastroenterological surgeon. I believe he is still around in Bombay. He got his LL.B, applied to the Bar Council of Maharashtra and Goa for enrollment as an advocate. The Bar Council said, yes, we will enroll you, no problem. But you must give up your medical practice. He went to Supreme Court against the Bar Council decision, and the Supreme Court gave a judgment, 3 judgments. It gave a judgment that in favor of Bar Council, it gave a judgment that if a doctor wants to practice law, he must give up his medical practice. Now, this judgment, unfortunately, I'm not blaming the judges. After all, the judge does not do much of investigation and legal research himself, though some of them, sometimes they do. A judge listens to both sides who produce the arguments and then decide. In this case, in this particular case, it was never argued before the Honorable Supreme Court that in most of the common law countries, that is USA, Canada, England, Australia, New Zealand, this is allowed. I have met those persons personally, that they have got a law degree and a medical degree. They practice their medicine as a physician, and they also appear in courts for their clients. If this can be the scenario in many other major countries, why not in India? So without trying to blame anybody, my further point is, what have the doctors done about it? These are the issues, major issues, which should be tackled by the IMA. Why? Because as I said, it was a 3-judge bench. Obviously, a senior advocate will have to be engaged to get this judgment reviewed. Engaging a senior advocate means expensive. And it is a general issue for the whole medical profession. But the IMA has never been interested in this. It's another matter. I have talked to senior people at the IMA headquarters, President and the General Secretary. They say, yes, it's a very good idea. We'll do that. But they never do so. So that is why I said that it is one thing for doctors to say that injustice is done against them. But if it is done against them, injustice, they have to fight against it. There's no other way around it. I will just at this point like to give 1 or 2 more examples of injustice against doctors. Somebody filed a writ petition, permanent Kataria, in 70s. And so IMA was a part to it. IMA was made a party by the Supreme Court. And the IMA gives a statement on affidavit. Yes. When a patient comes to a doctor, then it would be his duty to attend to him in emergency. Fine, I have no problem with that. But what prevented the IMA Council or the IMA, what prevented them to tell the Honorable Supreme Court Justices that, my lords, we agree that when a patient comes in emergency, it's all a case of roadside accidents, then we would never hesitate to provide emergency treatment, etc. But your lordships may also record that such services rendered in emergency should be compensated in some way, and they cannot be given totally free. Nothing prevented them. But if we keep quiet in front of the judges when a matter is being discussed which concerns us, then we suffer the consequences. About 5 years ago, the Honorable Supreme Court gave a judgment when there is a case of throwing acid upon a girl, then the doctors will provide, doctors and hospitals, they would provide free treatment, including plastic surgery. Now, free treatment and plastic surgery and all those things don't grow on the trees. Everybody knows it. The judges also know it. But someone has to plead before the judges. We have a nice system to show a judge with a blindfolded judge. The idea there is that judges want to be impartial. That does not mean that they are not hearing. But if our councils or medical associations, they keep quiet in such situations, now what prevented someone to tell the Honorable Court that, sir, we are ready to provide all those emergency treatment, including plastic surgery, but it entails a huge cost. And the Honorable Court may kindly provide some mechanism for reimbursing that cost. So, this is the example of injustice. These 2 or 3 examples of injustices which are there. Certainly, they are there, I agree. The doctors keep on crying against them, that is true. They are justified, but they are not justified in challenging them in the court. And that is one reason why doctors should, if they wish, they should choose the profession of law. Because as you can see, I am speaking on this, as you can see, even in Hindi there is a saying, "Jaake pair na phate bibai, so kya jaane peer parai." This simply means that the real pain can be experienced, can be felt only by a person who experiences that pain. So if doctors who are crying now about injustice, if they become lawyers, probably they will devote more attention and particular attention to it. Now, next point which I want to discuss is there a need for doctors turned lawyers? Now, I say yes. There's a great need for people with a medical background and who have come to law. There's a great need for them. Let me tell you, in USA, there are about 20 universities which give a combined JD MD degree of 7 years duration. JD is juristic doctor, MD is doctor of medicine, of course. So these 20 universities give a joint JD MD degree. There's single time admission. They come out with 2 degrees. And as juristic doctor, they can practice law. As a medical doctor, they can practice medicine independent of each other without any bar by the court. And they are the people who can do better justice to a patient who comes with medical negligence, or a doctor against whom they are charged of medical negligence. It cuts both ways. It's a different matter that these things in USA have grown to such a level that now there is a phrase there called ambulance chasers. These ambulance chasers, the term refers to doctors, to lawyers. Sorry. So this word ambulance chasers refers to lawyers who come across or who come to know that some patient has suffered, some injury has occurred, and they approach them that, okay, don't give us a single paisa. We will file the case against you. If you win, give us the percentage. And can you imagine what is the percentage? Once I was a member of American lawyers group. The percentage is between 30 and 70%. That means, and there the things are in millions. So if a patient wins 10 million, then 7 million goes to a doctor. I am not criticizing anything at all. There must be reasons why something has developed in such a way, in some countries. All I'm saying is that there is a great need for doctors and lawyers with a double background. I know that in courts, the files keep on getting thicker and thicker, fatter and fatter, because the judges often want more time to study them. They say it's a thick file, we need time to study, and it takes years. I had a case with me which was filed in 1984, before the Consumer Act came into being. I didn't file the case, I was not there at that time. But this case came to me about 5-6 years ago. And it was such a pile of files. Everybody, it was in Tisari court, trial court in Delhi, a civil case. And every judge who keeps coming new, they put the file down that it will need more time. So ultimately the case was over, say, about 25 years. So this is just I told you this just as an example, that there is a need for doctors, need for lawyers who have been doctors, who can expeditiously argue and deal with medical negligence cases. Now, almost lastly, I come to the point. What has been my experience as a doctor turned lawyer? I will repeat. What has been my experience as a doctor turned lawyer? I have counted about 4 of them. I will come to them. At this point, let me tell all my friends that if Dr. Joshi permits, if time permits, I will be glad to answer any questions or doubts that you may have. Now, so I am on the point of my experience as a doctor turned lawyer. The experiences which come to mind immediately. One of them is that doctors are afraid of law. And you see, they're unnecessarily afraid. If injustice, as I said earlier, if injustice is being done against me, I have to fight against it. If I don't want to fight, I accept injustice because we have to deal with the courts and the lawyers, etc. Then the things are bad. And let me tell you in the passing, one does not necessarily have to have a lawyer to argue his case. The law gives full permission to anyone to appear in person. I give you 2 examples, and these 2 examples are so famous that many of you would have heard these names. One is Dr. Subramanian Swamy. He argues his own cases in Supreme Court and argues very effectively against very eminent lawyers. Dr. Subramanian Swamy is not an LL.B. He is not a lawyer registered in any bar council. As a matter of fact, he was a professor of mathematics in IIT Delhi. So one does not have to be a lawyer, but one has to one has to know law, and law can be learned by books and by being in practice. Second example I said two names I will give you, which all of you have heard. Second is that I'll recollect the name. The doctor who lives in USA, who filed a case in Supreme Court, well, not in Supreme Court directly. He filed a case in National Commission alleging medical negligence in the treatment of his wife. Before that, he had filed a complaint with the Calcutta Medical Council or Bengal Medical Council. Medical Council gave a 1-page or maybe 25-line judgment of the decision. No fault on the part of the doctors. Okay. That is why he had to come to the National Commission. And the National Commission said, since the Medical Council has found no fault, we find no merit in the complaint dismissed. Then he had to go to Supreme Court. And in Supreme Court, the long judgment. What was the name of it? So the Supreme Court gave a judgment awarding him something like 7.5 crores of rupees, which along with the interest came to about 13 crores. So this I have told you, Dr. Swami, and this case, in the context that one, that's right. Dr. Navarangi has told me, I forgot the name. You see, I think this name is so familiar to me, Dr. Kunal Saha. I have met him in Delhi 3-4 times. But I think nobody can escape, howsoever I may try to look young. So I was forgetting this. Dr. Kunal Saha, that's it. Okay. And now, since I mentioned about that case, let me take a small bit further. When he won the case in the Supreme Court did not give an amount to be paid by him. He said there was medical negligence, the opposite party's hospital doctor have to pay, and they referred the case back to National Consumer Commission, for the purpose of fixing the liability. The National Commission gave an award something. Then Dr. Kunal Saha came again to the Supreme Court against that small award given by the National Commission. He came to Supreme Court again for enhancement of the compensation. And he won. So you see, we have to be persistent, and we do not have to be afraid of law. I was fond of being afraid of law. Had Dr. Kunal Saha been afraid of law, well, things would not have taken this shape. He often argued his cases himself. Okay. Now, the first point was that doctors are afraid of law. Second point which I am going to say is that doctors are afraid of medical counsel. You might be surprised when I tell you the instances. You see, everyone knows that as per the erstwhile Medical Council Act, a person registered in any state as a doctor can practice all over India as a doctor. It is a common knowledge. But medical councils, including Delhi Medical Council, they insist that before a doctor practices in Delhi, he must himself register with Delhi Medical Council. This is totally against law. People know it. But they are
Delhi Medical Council के डायरेक्टर नहीं क्या करें? सुन लेना चाहिए इनके बारे में. Somebody speaking in between. Please mute yourself.
I can't hear what is being said. Okay.
So, Dr. Gupta, you please continue.
Okay, please. Okay. Yeah. So I was saying that the Gangaram Hospital in Delhi, they hold DNB courses. They wrote their requirement that they will admit persons to DNB only if they are registered with the Medical Council. So these are illegal requirements. The Gangaram Hospital is saying that we will admit in a DNB course only one is registered with Delhi Medical Council. All the Delhi Medical Council is saying that only those doctors can practice who are registered with DMC. These are patently illegal things. But the doctors are afraid of it. I advise them that challenge it in the High Court. You will win straightway. But they somehow don't want to challenge the medical council. They are afraid unnecessarily. So much so. The other thing is about the multiple, I told you earlier about the legal defense. If they don't allow advocates to defend a doctor and the doctor is held negligent by the medical council, they have to blame themselves. Of course, nowadays the trick I use is that when a case comes from Delhi Medical Council, a complaint against a doctor, I know that DMC will not allow me to appear as a lawyer. I file a small application on behalf of the doctor that I may be allowed to engage a lawyer to defend me, and this may be communicated to me, this permission. Nothing happens. But if the decision of the medical council comes against the doctor, it has happened in a recent case. So then I can easily go to the High Court and say that this decision of Delhi Medical Council is wrong because I, that means the doctor, was not allowed legal defense. So the point here is the doctors are afraid of medical council. I don't know why. And let me tell you, doctors think that the medical council is there to help them. Let them shed themselves of this misbelief. The medical councils take pleasure, sadistic pleasure, in blaming doctors, in holding them guilty, and they get a commercial pleasure also. What I mean is simply this, that I have been told by doctors themselves who have come to me and told me that there are demands of money by the medical council, that if we do not pay the money, the case will be decided against us. In this context, I just cannot forget a case of an 11-year-old child upon whom appendectomy was done. Then later on the child developed some arrhythmia, some seizures, etc., and other complications, and he died. When the child died, my client, that is a doctor who was anesthetist, he got a demand telephonically from somebody, another doctor, who is no more now. That, look here, Dr. So-and-so, this patient is known to me, our patient's father is known to me, you please pay 2 lakh rupees, or otherwise I will get a case filed and decided against you in Delhi Medical Council. My client did not pay anything, and sure enough, a complaint was filed against him in Delhi Medical Council, and it was decided against him. For a few weeks, I think 6 weeks, his license was cancelled. It was at that stage that I came into picture. I read all the papers available to me. I read the textbook of Harrison also, textbook of medicine by Harrison. Interestingly, postmortem had been done. Postmortem showed right ventricular hypertrophy and interventricular certain hypertrophy, and these were symptomatic of cardiomyopathy And Harrison at that time, the opening sentence on congenital cardiomyopathy, opening sentence was congenital cardiomyopathy often remains asymptomatic, and the first symptom may be death or arrhythmia. This is what happened in this child. Child died because of congenital cardiomyopathy. So I pointed out this thing to the Honorable High Court. They ordered that this case should be reviewed by Delhi, by the MCI. You see, in those days, at that time, there was no provision of a appeal to MCI. This came later on in 2004. So then I went to MCI, and sure enough, we won. No, we won not because we had done any magic. The report was already there, out of the report. So this I was telling you in the context that medical councils are not there to help doctors. They are there to harass them and also sometimes make money. And this thing I know in the context of various state medical councils. I have got personal experience, not only Delhi, but in Maharashtra and other places. So the purpose of saying this thing is that do not be under the belief that the complainant has gone to the medical council, and the medical council, being doctors, they will decide in favor of us. No. So don't believe the medical council. And lastly, it was on my experience as a doctor, as a lawyer. So lastly, I will give you an experience, sad experience, about the medical negligence that happens and that is overlooked by medical councils. What happened was, this happened about 12 years ago, 15 years ago. A 70 years old gentleman, Sikh gentleman, was undergoing arthroscopy of knee in the operating theatre. He suddenly developed some cardiac arrhythmia on the monitor. The anesthetist, who was an M.D. anesthesia from Delhi University and the Maulana Medical College. So he prescribed, now listen carefully, he prescribed injection Lasix, 1 gram intravenous bolus injection every 2 minutes over 10 minutes. That means in 10 minutes, he was given 5 grams of Lasix. While all of you know that the dose of Lasix intravenous is 20 to 40 milligrams. And the patient died, of course, within 50-60 minutes. So this case had come to me. I was supposed to defend the doctors, because that is the unfortunate lot of lawyers. If the patient approaches them, they fight for the patient. They plead for the patient. If a doctor approaches a lawyer, they plead for the lawyer. It is part of our professional duties. So, the medical council, Delhi Medical Council, did not find anything against this. The same paper which wrote injection Lasix, 1 gram every 2 minutes over 10 minutes. It was there for everyone to see with open eyes. But what we need is not only open eyes, an open mind also. So the Delhi Medical Council announced that no fault on the part of the doctor. So these are things which I have experienced, which have been interesting, sometimes sad also. Now, in the end, I would like you to, I've written, I think, 5 take-home points. First take-home point is, when you get a legal notice from a patient, treat it seriously. Don't think, oh, jab court mein case padega tab dekh lenge. Not like that. Take the legal notice seriously and consult a lawyer while replying to it. I will reply to the legal notice, not leave it unapplied. Second point is, when you get a notice from the medical council to give you a reply of defense to a complaint filed by a patient. You prepare the reply as a medical doctor, of course, but let the reply be prepared by an advocate. In other words, let there be a jointly drafted reply, because a reply drafted by only a doctor sometimes can be very tricky. It can be wrong. It can be true. I don't have time probably now. If Dr. Joshi tells me that I have time, I will proceed further. You can ask me further. So my second take-home point was that, that if you get a notice from medical council, number one, reply to it. Number two, reply to it with the help of a lawyer. And number three, file an application with the medical council that I want to be heard through a lawyer. And if the medical council denies that opportunity, you see the peculiar things. I have appeared before Delhi Medical Council, before UP Medical Council. Both of them denied appearance to me. You are an advocate, you will not hear you. I have argued before Maharashtra Medical Council. They have no problem. So these are totally arbitrary things. Law allows it. So if the medical council does not provide a permission to hire a lawyer, to engage a lawyer, then approach the High Court and you will win. Third take-home point is, if you have a desire to study law or to practice law, go ahead. Don't think twice. You will never regret. Remember these words of mine. And fourth is nothing new, but what I will tell might surprise you. Fourth take-home point is, act within your specialty. Do not transgress your own particular specialty. And then, you see, once a telephone call came to me from Bareilly. I don't mind these calls from doctors. She said, look here, sir, I have heard your name. I want some advice. I said, tell me. She said, I'm a gynecologian. Can I do cholecystectomies? Then I laughed, but not unable to offend her. I advised her that no, madam, your being a gynecologian does not permit you to do cholecystectomies. And I know of some gynecologians in South. They are doing mastectomies, breast cancer surgery. So once you go into these avenues which are not meant for you, certainly one day you will repent. And last point is that do not perform any procedure or surgery without consent. I will end here after saying a sentence. I have come across cases, even in Medanta Hospital, where they performed surgery on a patient without consent. It was my case for example. Anyway, so thank you very much. I end here unless there are some queries which are permitted by Dr. Joshi. I am available. Thank you.
Thank you, sir.
Yeah.
Thank you, Doctor. Thank you, Dr. Professor M.C. Gupta, sir. I don't know if you remember me. I'm Dr. Kane. We met 20 years ago. You've always been.
Yeah, it was.
You've always been an inspiration to all of us. And thank you very much for this very insightful talk. I'm sure everybody in this audience is now going to aspire to become a lawyer. And let us hope we see our day in the courtroom.
Sure.
And as a token of our love, respect, and appreciation, please allow me to hand over a small gift purse of about 1,25,000 from the Medico-Legal Society of India. Thank you very much.
What can I say? Except that I feel humble. I feel humble.
Dr. Gupta, sir.
Dr. Pratibhaji, I remember you very well.
Thank you, sir.
And let me tell you, if you do not mind, and others may listen, that on that day, on that night, on the party, you were looking gorgeous.
Oh my God.
Yeah. I still remember that. Okay.
Thank you.
Anything else?
Okay.
I think that's all right.
Yes.
My God.
He was sharing.
Yeah. Well, I will spend on my PA, etc.
Dr. Lalit, can I go ahead with the
Okay, sir.
Thanksgiving?
Everybody. Now,
So are we going to take some questions?
I just want to say one thing.
It will not be better.
I thank you very much for this award of rupees 1,25,000, and I hereby declare. See, I have got some health problem, so I am not active in the courts. I had 4 or 5 topics to file PILs. I will engage a associate junior lawyer, and I will get this done, and I will spend the money on paying him. So this money will not go in my personal pocket. I will take care to go in for the medical purposes. Thank you.
Thank you, sir.
Okay. May I begin? Everybody has heard enough and wants to relax now. Time is up for vote of thanks by our Honorable President of Medico-Legal Society of India, a very generous person, especially in professional or social environments. He can allow individuals to act selflessly and with genuine kindness towards others, even if such ventures don't directly benefit him. Now, over to Dr. Sanjay Gupta, President Sir, for vote of thanks.
Thank you, Dr. Lalit. You know, you have been so kind in introduction to everyone so that, everybody would appreciate that. But before I start my this thing, I must, of course, thank from the bottom of my heart our Guru, Dr. M.C. Gupta. And, some of the messages that he has given today are very, very pertinent, and we have to remember it for the long time. First of all, what he has said is if there is an injustice, you must fight, and that's what as doctors we have not been doing, and we have been always, complaining amongst each other, and that has been our bane. And I must again congratulate here Dr. R.D. Joshi, who has taken it upon himself that to exactly act the way Dr. M.C. Gupta sir has, told us, and taking things to the court. And what he also said is, don't be afraid of, the law. And that's exactly what the National Medico-Legal Society is all about. And that's what, Dr. Mukesh Yadav also told us about, the Medico-Legal Society. So, sir, the Medico-Legal Society is taking all your advice very seriously. And, you being the mentor to the Medico-Legal Society will see to it that all the advice that you're given will be, very rightly followed. Not only that, it is a little sad to hear about the, different medical councils with your vast experience, and that our own colleagues many times, create problems for the doctors. Well, if you remember, you may remember, you were, there in MCI Medical Council, where, I was one of the medical council members, and I'm definitely, you would appreciate that we had definitely listened to you very carefully, and, you're argued, a very competently for the doctor, and the case had gone, for the doctor in that decision, a particular decision. And so in Maharashtra Medical Council and also in the MCI Ethics Committee, you have done wonderful job. And I have tried whenever I was in these committees personally to see to it that all these kind of malpractices that you mentioned were definitely done away with during those tenures. But it's an eye opener listening to you on all these issues, and I thank you again and again about whatever the examples that you gave. Your wonderful exposition, and I think that will be quite inspiring to all of us. Then I must thank Dr. Lalit. He has been a wonderful host of today's meeting and comparer, and so nicely he has created this atmosphere of really congeniality, and people are really happy listening to his introductions. Then, of course, Dr. Jayant Naurange, who is again a doyen in this field, and again very quick and brilliant with his expositions, and he has told us, and that's how he in a second can recollect Kunal Saha and put it on the
not moving now.
screen.
Just move your arrow on the laptop.
And of course, our president-elect Mukesh Yadav, who is always there to help us, guide us, and he has done such a wonderful work. And not to forget Dr. Narasimha Rao. He presented the citation and beautifully. Wonderful job done by him. And of course, Shivakumar Kumbar, I think he was the one who presented the citation, and Dr. Narasimha Rao, the CV. So, all the friends have come together. This is a wonderful occasion, and we must thank again, of course, the founder of this, Dr. Rajiv Joshi, and the Lakshmi of today, Dr. Pratibha Kani, who actually presented the Lakshmi to our MC Gupta. And finally, we must thank also OrthoTV and Dr. Shyam of Ashok Shyam of OrthoTV, because this has been live on that TV, and that's how many of members across India would listen to Dr. MC Gupta and his wonderful experiences, in this field. So thank you all, and it's a great pleasure to have you. And Dr. Rajiv Joshi, I think you should have the final word.
Thank you, Professor Gupta, for accepting our request to give this lecture and accepting the small token of gift and declaring that it will be used for appropriate purpose. Now, I request all of you to put on your video cameras, please, so that we can have a group photograph. So all of you, please have a video camera on for 5 minutes with smile on your face. Narasimha Rao sir, Allah Prasanti, Madan Balaji, Madhusudan sir, Vijay Tyagi, Lalit Shah. I'm just calling out name because I'm seeing their cameras are off. 1, 2, 3, smile please. That's it. Thank you so much. And thank you, sir, Dr. Gupta, sir, for kind advice and support given to me personally, sir, and Medicolegal.
Sir, once again, one clip.
One clip? Okay, once more. Anybody wants to come into the picture?
Yes.
Madhusudan, sir, Narasimha Rao, Allah Prasanti, Unam, OrthoTV, Sarvan.
Yes, sir.
Okay. Smile, please. One last time. Click. Thank you.
Thank you, sir.
Thank you, Professor Gupta, for being with us right from my days of initiation of the medical PIL for violence against doctors, and throughout the generation of Medico-Legal Society. And I have been fortunate to be able to give advice from you as and when I needed it, and I'm grateful to you for that. And thank you, Gupta sir, for this wonderful end of session talk. And everybody, so I think let's conclude today's session, and we'll hope to continue with our weekly program henceforth. Thank you all. Thank you so much.
Thank you, sir.
Thank you, everyone.
We wish Dr. Gupta all the best in his health and all these matters.
Thank you. Thank you.
Good evening, Navaranga sir. Navaranga sir.
Yes, sir.
Yes,
Okay,
what
thank
do
you,
want to
thank
say,
you.
sir?
Thank you. Thank you.
Thank you, sir.
And I thank Siddharth for this wonderful job. Siddharth, you have been a blessing for us being in Delhi, and our junior friend who took all the efforts to take all the goodies to Gupta sir, shawl, Shrifal, bouquet. I am so proud of him that he has left from Bombay and is now practicing Supreme Court, and he is now representing Medicolegal Society also. And now he has been given the case from Dr. Mahesh Sinha sir for the ISC, same and ISA case. So I wish him all the best for his future, and he will be helpful to us as always. Thank you, Siddharth. Thank you so much.
Thank you, sir. Okay.